round off the day. So for the final talk of the day, I'm delighted to welcome back Dr. Eli Diamond again, who's going to just give us some updates on the ECD Registry. So a great way to close the day. Thank you.
So I'm going to tell you a little bit about the ECD Registry Study, which is a study that is housed, that lives at my institution, but enrolls ECD patients from Sloan Kettering and from outside Sloan Kettering. So it's not just about my patients. And among other things, one of the main interests of the study is looking at various issues related to symptoms and quality of life of ECD patients. So that I'm going to give you the results from that for about 100 ECD patients that we have that kind of information on right now. Okay. So a registry study is really a way of following a group of patients over time. And this is something that is of particular use for rare diseases where there is not a lot of collective information, and what is learned is from sort of small groups of people here and there. And the idea is to sort of gather as much systematic information as possible to try to further knowledge about a disease. So for this registry study, I gather quite a bit of detailed clinical information about the patients and symptoms and things like that, or I should say scan findings, sort of things from records and from scans. And then we get what are called patient-reported outcomes, which means measures of things like symptoms and quality of life that are where the data comes from you, and and not from a scan and not from a lab value. So as I said, the study is housed at Sloan Kettering, although anyone can enroll. And at the moment, we have like a sister, sort of a mirror version of the study in the UK. So the idea of the study is to, as I said, to gather sort of comprehensive information and to get a sense of what kinds of manifestations of the disease respond to what kinds of treatments. And this is meant to be a resource to the entire community. And the idea is that the information that we get is patient-centered, which is to say that we're getting information that's important to you. I want to just say one thing to make an advertisement, which is that a related study to the registry study is the availability of doing gene sequencing on ECD tissue. I think that many patients here today have had the availability of things like BRAF testing or other kinds of testing on their biopsy material, but if for any reason that is not available, that's something that we have an initiative to be able to do even for patients who are not mine. And that's sort of a companion to the registry study. So if there's someone who, your treatment could benefit from having that mutation information, not as a matter of curiosity, but if that could help direct your care, then we can do the gene testing, even if you're not one of my patients. And there is actually ways of doing testing for BRAF and other gene mutations on blood samples, not even on tumor samples. So if you're in a clinical circumstance where knowing your mutation could affect your treatment, we could possibly even just test a blood sample, even if there's no biopsy material left. So if that's something that would be of interest, please just be in touch with me, and my email address is at the end of the presentation. So the goal of getting what are called patient-reported outcomes is to understand how you guys live and what determines that and what affects it, and what are things that affect symptoms and quality of life, and how we can make treatments more responsive to those kinds of things. So what I would envision is that there could be, if in the next phase or in the next version of an ECD trial, that we would look at not only what affects people's scans, but what affects things that are important to you and how you live, like your symptoms, fatigue, for example, which was talked about today. So the idea would be to learn enough about things about the disease that influence how you live so that we could follow those in studies in a meaningful way. So this is the list of surveys that we get from participants in the registry. These are things related to symptoms. We actually have a survey, a symptom scale that was made specifically for ECD. And then we look at things like pain, fatigue, mood, what are called supportive care needs, which is things that would help support you that may be unmet needs. There's a whole measure of side effects of treatment, and then issues related to daily functioning. And we get these from the participants once or twice a year, pretty much. This is just to remind me to tell you that the ECD Symptom Scale is this, it's a scale which looks at 63 different ECD-related symptoms broken into different categories. And the idea about this is that one patient may have completely different symptoms than someone else. And how do you have some kind of, how do you measure people's symptoms that accounts for that level of variability across the disease? So among these 63 symptoms, when someone fills out this survey, they pick the 5 symptoms that are worst for them and rate the severity of them, so that someone may report symptoms 1 through 5, and someone may report others, but we have the severity information about the 5 worst symptoms for everyone, even if they are different symptoms. So currently there is close to 150 people who have enrolled in this study. About 125 have completed at least their first set of these patient-reported outcomes, and then about half of that have done what would be the next step in follow-up. So I'm going to show you what is the data from the first about 100 people who have done that. And only about less than half are treated at my institution, and the rest are from various other places. Just to give you a little bit of information about their clinical condition, this is disease location that's reported by patients. And this is the treatments that people are on participating in this study. So a lot of BRAF inhibitors, MEK inhibitors, and combined treatment, and then some people who are off treatment, either on an interruption, or these may be people who received chemotherapy at some point and now are off treatment. So these are what I would call the neurological or psychological symptoms. And the way you look at this table is that about 50% of people who did the survey responded yes to having stress or anxiety. 50% endorsed having memory problems, trouble with balance or walking, depression or sadness. So if your eyes can sort of scan down here, you'll see the very large number of neurological or psychological symptoms that patients have. And then we've talked about this, so this won't be a surprise that 69% of the participants endorse having fatigue, decreased sexual interest, frequent napping, and just a whole variety of various symptoms. And then others as well. About half have aching bones or joints or some other kind of pain. This is a very complex slide, but what this is telling you is this is for the entire group, the most severe symptom. And so for everyone's most severe symptom, about 40% of the time it's neurologic. And about 30% of the time it's constitutional, meaning generalized, things like fever and sweats and fatigue and things like that. What this is telling you is that for people's most severe symptom, rated from 1 to 10, the average was a 7 out of 10 in severity. So that reflects quite a bit of symptom, in my opinion. And this is a comment on how frequent a symptom is. And so people's most severe symptom, this means, this says almost constant, so people's most severe symptom is typically frequent as well. So there's a lot of information here, but I'll walk you through it. This is looking at depression, and about 2/3 of the participants don't meet sort of loose criteria for depression, but that means that 1/3 did. And similarly, about 1/3 of the participants meet some kind of criteria for anxiety. And this is a quality of life score. So this is a large survey of 25, 30 questions, and it gets lumped into a number, and that number reflects some kind of measure of overall quality of life. And the way that you interpret this is, there have been studies done of 2,000-3,000 cancer patients, and they take those numbers and they sort of translate those into what are the circumstances of that person. So with this number, if you look at one of those where people are in the function scale, this overall quality of life is comparable to someone who spends 50% of the time in bed. So I think that's a very powerful statement about symptoms and quality of life. And this is the percentage of the participants who described having some kind of unmet need. And so your eyes can sort of scan down here. With the most common unmet need is addressing fatigue and lack of energy, not being able to do things you used to do, uncertainty about the future. So a lot of echoes, I think, of what things that we've heard today. So in conclusion, I think that looking at this kind of information and doing this kind of research demonstrates things that I think you guys all know are true, but that haven't been really studied in a systematic way, and to demonstrate it. And there's a particular burden of neurologic and psychologic symptoms and a whole variety of different kinds of unmet needs. And I just want to emphasize that these participants are not untreated patients. This is in people who are mainly in active treatment. So it means that we have a lot of work to do, and I would envision that measures like this would ideally be incorporated into the way that we evaluate whether treatments are working. That's it. And my email is here, and there is an email account for the registry study if you ever want to email to get more information. That's it.